We checked the arterial line. Jill, sucks around the aortic valve.
Pump flow is fine.
All right. Let's get this sclerotic calcified mess out and put our freshly picked baby in. Actually, hang on. Should I save this guy or not?
Dr. Knight?
Seriously, he's a fat, sexist shock jock who adds nothing to the world. So just saying.
Hugh, mate, flow is falling.
Show of hands. We forget to connect it up properly and no one's the wiser.
Hugh, you need to...
No? No?
Hugh?
No. All right, then I need to hear Debbie. Gonna need you guys in on this as well. Once I had love and that was a gas. Soon turned out, had a heart of glass. Can't hear singing.
Okay, fatty, let's get you back on the air today. Morning, save a life.
I think a small hand seems appropriate. And louder.
Want to see how deep it is?
Jesus, your finger.
Let's stick the surface. His chest is filling up with blood. He needs a thoracotomy.
I'll get a chest tray.
3O proline for stitching. Got to keep pressure on this ventricle to control the bleeding. If he loses any more blood, he's going to die. Right, you're going to cut.
I'm a nurse. We don't really do that.
Well, I can't take my finger out. Look, it's not that difficult. You're going to slice a line 5 centimetres either side of my finger. Okay? Get ready with that suction to clear the blood out. Then I'll suture around 8 or so stitches. Go. Look, we're lucky. It's not that deep. Are you good? Good. Other side. Good. Open him up. Go. Suction. All right, patch. Suture. Keep it clear. Fingers coming out. There'll be pressure, okay?
Gotcha.
And coming out. Good. Keep it clear. One more. That's done. You.
I've worked in hospitals for 20 years. I could probably do it myself. We'll need a chest tray.
Okay.
Miss Pig, before we go on, let's talk ethics.
Let's just start, Aoife.
I know every animal rights person in town. One tweet, and I will shut you down.
Rod Eagle's pig was destined for BLTs in the next week, according to Ajax. We've saved it.
It's prison break with pigs.
He'll be a famous pig and a loved pig. A happy pig.
All right. Our little secret, everyone. Let's give Porky a few extra months of life.
Well, hello, everyone.
Hi.
Doctor, what are you doing? It looks like surgery, but that can't be right, can it?
I'm putting an experimental artificial heart in a pig.
I couldn't have guessed that answer. Really?
Yep. You got me.
That sounds cool. Can I watch?
Sure, you can assist if
Great.
you...
I'll scrub in.
Right. Connecting the aorta.
Blood flow's good.
Thank you. And connected.
Wow, look at that. You want suction around the aorta?
On it. Proline 3O.
Unexpectedly good choice.
Is the main worry clotting?
Well, usually yes, but we use cow tissue to cloak the entry point. That, we hope, will make the difference.
I'm going to call you San Francisco.
You know, I left my heart in San Francisco.
Ah. Yeah, I think my granddad had that.
Standing on.
All right, let's close and see what happens when he wakes up. All right, everybody, here we go. Are we ready? Let's proceed.
Where are the ambos?
12 minutes.
I'm timing it.
Danny, suck on that whistle as hard as you can. It's your best friend, believe me.
Nasty.
Open fracture of the leg. This protruding bone's going to cut an artery if you can't be still.
I don't blame him.
All right, get round here, sit on his thigh so I can splint it. That's it.
All right, go.
Bugger it.
Swap.
Okay. Don't stop, Danny. Keep going. That's it.
Done.
Fine, just... We're knocked out of me,
Aoife? Get him an x-ray. You may have broken ribs.
Just look up for me. You have a detached retina from the impact. Ken!
Am I blind?
No. You're going to Brisbane where they're going to reattach it. And when you wake up, you're going to see the Great Barrier Reef. You say hi for me, okay? Doctor. Okay, evac, Royal Brisbane, detached retina. Dr. Sloan. Sloan, got it.
Print out of a guy in the chairs. Trouble breathing, ribs maybe.
Shit. Where is he?
Through there.
It's not his ribs. 14 gauge needle.
The big needle?
Yes, the big one. Tension pneumothorax. First intercostal, second intercostal there. Hold that.
Yep.
Yeah, all right. Let me see. Penny, I need you.
Yes, 1 second.
Haven't got a second.
I'll swap. Put pressure on the wound, stitch it fast, and bandage it.
Okay. Betty, can you get dressed?
Tension pneumothorax. You need to do it. I've done 100, but never one-hander. Too dangerous. We nicked the heart. He's dead. We done one?
I've done exactly one.
Oh, this should be a snap. Mid clavicle, second intercostal space.
It's
Just
bloody
there.
dangerous.
So is dying from a collapsed lung. Now remember, not too deep, but it'll pierce the heart.
Yeah.
Doctor, I've got a cardiac arrest.
Here.
Oh, shit.
Penny, go! Yep, move.
Midline scar.
He's had a bypass. Paddles? Shit. All right, you're doing it. Here and here. On your call.
Clear.
Nothing. Again.
Clear.
Nothing. Again. Hit him again.
Clear. He's back. Hugh!
Take that. Yep, they just got here. Thanks.
I'm not going deep enough. It should hiss, right?
Yeah. All right, we're going to do this together.
Okay.
You control speed and angle, and I'll control the depth. Okay?
On 3. 1, 2, 3.
I love that sound. It's
Beautiful.
Plane's ready, ambulance is at the door, 3 on the plane to Sydney, ambulance to regional centres.
Like clockwork, Ken.
How's that arterial pressure?
We're live streaming to investors. Don't distract her.
Okay, let's introduce his own blood flow.
Taking him off bypass.
Restoring perfusion. Obs look good. It's pumping. Let's join the
Pulmonary arteries.
bypass removed. Heart looks good. The blood flow, arterial pressure's a bit low.
You're leaking blood.
What?
You've got to bleed. I can see it.
BP dropping 92/46.
Sutures have burst on the aortic anastomosis. Fuck!
All right, get him on bypass.
BP 87/43.
Now! Hey! Hey!
Let's get the bypass back on fast.
41/20.
Hugh, gown and gloves.
Here you are. Just doing it up.
Don't worry about that. Gloves.
No recordable BP.
Shit!
He's gone.
Don't push till I say. Finish this, will you? I can't bear childbirth, all that whining.
Sure.
You look like shit. I said don't push. No genius, this one. I fear for the kid, frankly.
Okay, Harriet, I'm Hugh, and you are going to be fine. Just going to examine you to see how far along you are. This may be a touch cold. And I would say that you are 10 centimetres dilated. You are going to have a baby.
She's crowning.
All right, here we go. All right, we get one big push for me. That's it. Mia, you want to catch?
Okay. Come on. Of course, no problem.
That's it. Just supporting the head there. Good. First baby. First job.
Yes.
You'll be fine. One more big push. There we go. And a little boy. Well done.
Caught a baby, it's not that hard. What's wrong?
Brownie again. Twins.
Really?
What, you haven't been scanned?
It's hard to get into town.
All right, Ken, another crib. Quick. Another boy. Let's clamp and cut. Here we go. Well done. Just going to take cover for a second. Here we go. Mia, meconium in his mouth. Just to suction that out. Here we go. Where's Ken? Ken.
There's another one, she's crowning again.
Okay, triplets. All right. Here we go. Keep that bottom down for me. That's it. That's it. There we go. There we go. Oh, it's a little girl. Oh, can't hear crying, Mia. What's going on over there? Are you crying?
No, I'm not. I'm a professional.
It's a very messy thing, isn't it?
All right. Well done. All okay.
Thank you.
Now, we're just going to give you an injection to help you deliver the placenta, okay?
Can you get your ram out of the wards, please?
It's not my ram.
It sounded like I was starting a conversation.
His potassium levels are really high. Up his fluids and administer sodium bicarbonate. Pupils equal and reactive. No sign of neurological damage.
Hey, Penny.
I don't think this is just a minor head wound. We're missing something.
His kidneys are shutting down.
Traumatic rhabdomyolysis. He has crush syndrome.
How is that even possible? The car wasn't crushed, it was barely even scratched.
I don't know, but it explains everything. We need to find the crushed limb. There it is.
There's splinters in his fingertips.
Yeah, he had logs of wood in the back of his van.
So what if he was cutting down a tree when it fell on him?
Must have dragged himself back to his car.
I've got no pulse here. Is he crashing?
No, I've got a pulse here. It's the leg. No blood flow. The pressure's building up and we need to release it. Somebody page Hugh! Hold on, mate. The backup generator come on. The ventilator's gone out. Mia, start bagging him. Hugh, close him up.
Well, he just started.
We have no power. Close him up, Hugh.
If I stop now, he loses the leg. Come on, you're not in Sydney anymore.
I've got torches.
Okay, then. Betty, try and find out what happened to the generator. Okay.
Go on, admit it. You love this. Breaking the rules.
This is medieval.
Maybe. Bet you didn't save any lives in Sydney.
I swerved to avoid a pigeon once. That counts.
Ha. So, I've designed a new stent, shaped like a helix.
Sounds interesting.
It's revolutionary. The inventor of the helix stent will be written on my tombstone.
So, what's wrong?
No one will invest in us anymore, or a laughingstock. If only we had some sort of funding or grant.
Oh, cut the crap, Hugh. You know I have a research grant.
I may have heard something about it.
Then ask me the question.
Penny Cartwright, will you fund my stent?
Sorry, can't. I've already decided to fund a research program into foot fungus.
Oh.
Could make some real breakthroughs.
Come on. This is a really good idea.
I don't know. I'm just not hearing enough begging. Finessed a bit.
Okay, I found the blade. Give me some room.
Keep on the BP, Nia.
Still stable.
Suture.
Heart rate steady.
Blood pressure normal.
All right, bleeding stopped.
You did it.
We're not out of the woods yet. Transport?
Standing by.
Okay. Let's get him prepped ready for Sydney. Haven't done one of these.
I've got it on YouTube if you need it.
There's a catheter inside the bronchoscope. A thin, flexible tube.
We'll be going in through the nose.
I hate that. We're choosing a lobe to go in and open up the smooth muscle with.
Right, can we do both?
No, only one. It can trigger a bigger attack before it works, so doing both is too dangerous.
Okay, hit me.
It shrinks the smooth muscle and hopefully opens up some ability to breathe again.
Again.
Okay, I think that's looking good.
We should put ours on YouTube.
Absolutely not.
Hit it. So, got that test stuff cleared up, huh?
Yep.
Yep. Hit it.
Okay. Seems to have opened it up.
She can breathe easy. As can you, Dr. Knight.
Ha.
She's a-comin'.
And you make sure of the blood vessels, right?
Done your reading, huh? Here it comes. Just eyeball it. Looks good. Annie, you want to travel it over?
Love to.